From ancient battlefields to modern care, a journey through military medicine. Introduction, the hidden story of war. When we think of historical battles, we picture cavalry charges, sieges, and tactical brilliance. But behind every campaign lies a quieter story, one of healing hands, herbal remedies, and the gradual evolution of care for those who fell in combat. This is the story of how medicine transformed warfare, and how warfare transformed medicine. The early medieval world, survival on the march. In the centuries between the 7th and 15th, armies were less like organized institutions and more like moving towns. When soldiers marched, they brought with them entire civilian ecosystems, families, cooks, washerwomen, smiths, and healers. Strategy followed harvest cycles as much as politics, because the land itself was expected to feed the army through requisition, barter, or outright plunder. When warriors fell wounded, there was no formal medical corps waiting. Instead, treatment came from whoever was available, monks from nearby monasteries, household physicians of nobles, fellow soldiers, or the camp followers themselves. These healers worked with what they had, wine and vinegar to clean wounds, honey and animal fat as barriers against infection, and herbal poultices made from whatever grew nearby. The Islamic Golden Age, knowledge preserved and advanced. While Europe struggled through its early medieval period, the Islamic world was experiencing a golden age of medical knowledge. In Al-Andalus, around the year 1000, a surgeon named Abu al-Qasim al-Zahrawi, known in Europe as Albucasis, was compiling an extraordinary surgical encyclopedia. The Kitab al-Taf illustrated about 200 surgical instruments and described treatments for fractures, dislocations, gangrene, and wound care. This work would become the standard surgical text in Europe for centuries. In Persia, Ibn Sina, called Avicenna in the West, synthesized Greco-Islamic knowledge into his canon of medicine, a comprehensive guide to diagnosis, drugs, and surgery that would shape medical teaching across continents and influence how physicians approach trauma and infection for generations. The Crusades, where cultures met. The Crusades brought these medical traditions into direct contact. In the fortified hospitals of Jerusalem and Acre, Western doctors worked alongside those trained in Islamic techniques. The Hospital of St. John, run by the Hospitallers, maintained multiple salaried physicians and surgeons who adopted techniques from texts like al-Zahrawi's encyclopedia. These hospitals were surprisingly sophisticated institutions. They combined care for pilgrims, poor locals, and wounded soldiers, with large infirmaries, chapels, pharmacies, and designated wards for the very sick. Medical practitioners operated under local law codes that addressed licensing, malpractice, and fees, a surprisingly formal framework for medicine in a war zone. When crusaders fell wounded, surgeons moved around the battlefield to assess injuries and decide who could be saved. Common procedures included extracting arrows and bolts, suturing sword cuts, setting and splinting broken limbs, and even trepanning skulls when bone fragments pressed on the brain. They also managed chronic conditions, excising diseased gum tissue caused by scurvy, showing they recognized the connection between nutrition and health. The pharmacy of pain, medieval remedies. Throughout this era, pain management was both an art and a gamble. Since ancient times, healers had mixed potent sedatives to help patients endure the unendurable. An 8th century recipe from Monte Cassino combined opium, henbane, mulberry juice, lettuce, hemlock, mandrake, and ivy, a deliberate attempt to create deep sedation before surgery. By the High Middle Ages, surgeons used the spongia somnifera, a sponge soaked in juices of narcotic plants, dried, then re-wetted and held to a patient's nose to induce stupor. In England, a potion called Dwale mixed bile, opium, lettuce, bryony, henbane, hemlock, vinegar, and wine. It could render patients unconscious, but carried a serious risk of lethal overdose. For lesser pains, healers turned to gentler herbs, rose, lavender, and sage for headaches, wormwood, mint, and balm for stomach troubles, licorice and comfrey for lung problems. Battlefield balms often blended wine or vinegar with honey and plants like comfrey, borage, yarrow, and bugle, mixtures that could partly clean wounds, staunch bleeding, and provide mild relief. Yet even the most powerful herbal sedatives couldn't fully block surgical pain. Surgeons also depended on strong alcohol, physical restraint by assistants, speed in their cutting, and sometimes verbal reassurance or religious ritual to help patients endure operations. Renaissance Revolution, Ambrose Pare. In the 16th century, warfare itself was changing. Gunpowder weapons created new types of injuries, gunshot wounds, shattered bones, and extensive soft tissue damage. Traditional treatments seemed inadequate for these modern horrors. Then came Ambrose Pare, a French military surgeon who would revolutionize battlefield care. Serving in campaign after campaign, Père made a radical discovery. The standard treatment of pouring boiling oil on gunshot wounds was not only agonizing but unnecessary. He abandoned this brutal practice in favor of gentle dressings. He promoted ligature of arteries rather than cauterization during amputations. He designed surgical instruments and improved artificial limbs. Most revolutionary of all, Père insisted on treating common soldiers as carefully as kings. This humanitarian ethos raised both the status and the moral foundation of military surgery, transforming it from butchery into a healing art. The age of organization, logistics and life. As the 16th, 17th, and 18th centuries progressed, warfare became more organized, and so did its support systems. Standing armies demanded predictability. States established fixed supply depots called magazines, stocked with flour, biscuit, salted meat, and peas. Military commissaries and contractors provided provisions. Regimental surgeons were formally appointed, though training standards remained inconsistent. This era also saw the development of standardized rations and medical roles. Uniformity simplified chaos. Dedicated surgeons, orderlies, and hospitals became part of the military structure. Yet the fundamental challenges remained. Across nearly all wars before modern sanitation, more soldiers died from disease than from wounds. Dysentery, typhus, malaria, respiratory infections, and scurvy killed far more than bullets and blades. Crowded, unsanitary camps with poor food and contaminated water made armies ideal breeding grounds for epidemics. Dental care during this period was minimal and almost entirely reactive. The main treatment for toothache was extraction using forceps and levers wielded by barber surgeons or itinerant tooth pullers. Facial and jaw injuries were treated as part of general surgery, with cleaning, debriding, and sometimes crude splinting. The Napoleonic era, speed and system. Napoleon Bonaparte pushed old military systems to their breaking point through rapid movement and aggressive foraging. But his campaigns also produced one of history's great medical innovators, Dominique Jean Larrey, Napoleon's chief surgeon. Larrey pioneered systematic triage, treating the most severely wounded first regardless of rank, a revolutionary concept in hierarchical societies. He created flying ambulances, mobile teams that collected and treated casualties during battle rather than waiting until fighting ceased. Larrey oversaw medical operations for the Grande Army through triumphs and disasters, combining speed, compassion, and logistical innovation into a model of modern military surgery. Meanwhile, in Russia, Nikolai Ivanovich Pirogov was developing his own innovations. During the Crimean War, he applied ether anesthesia widely to battlefield operations, one of the first to do so in combat. He refined triage systems, pioneered the use of plaster casts for immobilizing fractures, and organized corps of nurses, emphasizing that rigorous anatomical knowledge should form the basis of surgical practice. The Crimean War, Florence Nightingale's revolution. It was in the Crimean War that perhaps the most transformative figure in military medical history emerged, not a surgeon, but a nurse named Florence Nightingale. When Nightingale arrived at the Scutari Barrack Hospital in Constantinople in November 1854, she found conditions almost unimaginable. The facility was overcrowded and filthy, with defective saws, poor ventilation, infested clothing, and shortages of basics like soap, bandages, and clean linens. Infectious diseases, typhus, typhoid, cholera, and dysentery, caused up to 10 times more deaths than battlefield wounds in the early stages of the war. Nightingale brought 38 volunteer nurses, including 15 Catholic nuns, and set to work with systematic determination. She organized rigorous sanitation efforts, cleaning wards, flushing sores, improving ventilation, and enforcing hand-washing. She procured essential supplies using personal funds and donations, 200 Turkish towels, clean shirts, soap, plates, and cups. She established a laundry for clean linens, set up a kitchen for special dietary needs, and even created a classroom and library for soldiers' intellectual stimulation during recovery. The results were dramatic. Within months, through her efforts and her advocacy for a British sanitary commission that overhauled infrastructure, the hospital's death rate fell from around 42% to about 2% by mid-1855. A reduction by two-thirds, achieved primarily through cleanliness and organization. Nightingale also revolutionized how medical data was used. She compiled and analyzed statistics on hospital conditions, producing an 830-page report that used innovative visualizations, including her famous Rose diagram, a type of polar area chart, to demonstrate the impact of poor sanitation. Her work led to War Office restructuring and the 1857 Royal Commission for the Health of the Army. Known as the Lady with the Lamp for her nighttime rounds to monitor and comfort soldiers, Nightingale provided personalized care while training nurses in efficient bedside practices. She collaborated on the design of improved hospitals, including a prefabricated facility at Renkyo that achieved a death rate less than 1/10 of Skutaris due to better hygiene and layout. The American innovation, Letterman's system. Across the Atlantic, the American Civil War was producing its own medical innovations. Jonathan Letterman, medical director of the Army of the Potomac, reorganized battlefield care with a dedicated ambulance corps, echeloned field hospitals at different levels, and standardized evacuation procedures. His system for moving, treating, and tracking wounded soldiers became a template for modern military medical logistics. The chemical revolution, true anesthesia. Perhaps the most transformative medical advance of the 19th century came not from military sources but from civilian experimentation, the development of true chemical anesthesia. In the 1840s, diethyl ether, nitrous oxide, and chloroform began to be used as general anesthetics, allowing patients to be rendered unconscious and insensible to pain during major operations. Ether was first widely demonstrated in 1846 and quickly adopted. Chloroform, introduced in 1847 by James Young Simpson, spread rapidly because it was easier to use, though it carried higher risks. When these substances reached military practice in the mid to late 19th century, surgeons could attempt longer and more precise operations, complex amputations and wound explorations that would have been intolerable under older herbal or alcohol-based sedation alone. Yet even then, the old remedies didn't disappear. Herbal poultices, opium preparations, and alcohol remained important for post-operative pain relief. 19th-century battlefield medicine combined new chemical gases with centuries-old narcotic and botanical traditions. The Industrial Age, science meets war. By the later 19th century, industrialization had transformed military logistics completely. Railways and steamships moved supplies. Canned food preserved nutrition. Permanent logistics corps managed the flow of material. Vaccination, anesthesia, and antiseptics became standard. Armies could operate globally and continuously. Modern warfare, in a real sense, began not on battlefields but in factories and rail yards. The ability to feed, supply, and heal soldiers at scale determined what tactical brilliance could achieve. Nightingale's lasting legacy. Florence Nightingale's influence extended far beyond the Crimean War. Her methods emphasized preventive and systematic care over reactive treatment, shifting focus from mere wound dressing to holistic environmental and organizational improvements. This approach profoundly influenced the development of trauma nursing, the field dealing with acute injuries in high-risk settings. Her insistence on sanitation and infection control, on hand washing and clean environments, directly inspired modern protocols like aseptic techniques and hospital-acquired infection prevention. Her use of evidence-based practice through statistics influenced trauma nursing's reliance on data for triage, resource allocation, and outcome tracking. Her emphasis on professional training and organization of nursing staff led to the establishment of the Nightingale Training School at St. Thomas Hospital in 1860, professionalizing a field that had been considered low-status work. Perhaps most importantly, her holistic approach, focusing on nutrition, comfort, vital signs monitoring, and psychological support, highlighted the importance of comprehensive recovery. This influenced trauma nursing's integration of physical, emotional, and rehabilitative elements in treating shock, pain, and the long-term effects of injuries. Conclusion: the long view. Looking back across 12 centuries, a clear pattern emerges. Armies won by solving food, transport, and disease faster than their enemies. Tactical genius mattered, certainly, but logistics and medical care determined what tactics were possible at all. From the herbal poultices of medieval camp followers to Nightingale's statistical analyses, from the surgical innovations of Islamic physicians to the triage systems of Napoleonic and American doctors, each generation built on the knowledge of those who came before. They learned through trial and error, through cross-cultural exchange, through the terrible laboratory of war itself. The journey from dwale and boiling oil to ether and antiseptics, from chaos to organization, from acceptance of death to systematic prevention of it, this is one of humanity's great stories. It's a reminder that progress is possible, that compassion and science can work together, and that even in humanity's darkest moments, there have always been those who sought to heal rather than harm. Nightingale herself put it best when she elevated nursing from a low-status job to a respected profession, demonstrating that systematic care, rigorous standards, and genuine compassion could transform outcomes. Her wartime innovations established lasting impacts on global healthcare standards, especially in trauma settings where quick, hygienic, and organized interventions continue to save lives today. The lady with the lamp showed the world that light, literal and metaphorical, could drive away the darkness even in war's most desperate places.